Hello everyone and APMCSN. I am Siti Aisha P. Kanakan, the project head of our last series of our basic professional skill toolkit. So for our 7th episode of our series, we will talk about everything about general physician and moonlighting. For today, we have our guest who is a house physician or hemodialysis physician on duty at First and News Kidney Care Alabang Town Center from 2018 to present. A primary care and general practice including telemedicine and minor surgeries from 2017 to present. A full-time faculty, assistant professor in the LSMHSI. He is also a lecturer in top-notch PLE review, and he is a very active researcher. He is a clinical research and medical officer and a science research specialist, RCP, for COVID-19 treatment using indigenous plants. So let's all welcome Dr. John David Monson. Hello, Doc.
Hello. Yeah, thank you for the introduction. Yeah, good evening to you.
Good evening po. How are you po, Doc?
Doing well, despite the busy schedule, the commitments. I can say naman that I'm enjoying and I'm feeling fulfilled of what I do.
That's good to hear, Doc. You're really my inspiration, Doc. So, Doc, I'll have some few questions about your practice. All
right.
Okay. So, Doc, how would you describe general practice and moonlight industry in Philippines po?
I would say that it's one of the not so obvious or very underrated for me na pillar of our healthcare system. This is from the point of view, I think, of medical students because in med school, I noticed, both as a student and already as a faculty, as a teacher, much given or a lot of emphasis given in residency training, which is like seems to some students that it's the only way to go. But yeah, when you're already here, out here, in the real world, in practice, you can see that most big bulk of the healthcare services that Filipinos receive come from the primary care setting or from general practitioners and moonlighters. So it's very ubiquitous. That's what I can say here in the Philippines.
Oh, okay po, Doc. So, how about when it comes to opportunities po? Marami po bang opportunities ang general practitioner po?
Yes, I can say that there is. But in my own experience, my search for opportunities before, when I was a newly passed na physician, was only here in Manila, Metro Manila, particularly nga sa Southern Metro Manila and also in the Cavite area. So, naubusan ng positions and there is actually a lot of groups in Facebook. I'm just not very updated on them, but there's a lot now where they post openings. So I think it won't really be so hard not to find an opening for someone who wants to moonlight. I just think yung location yung hindi ako sure. I cannot speak for other provinces or in the Visayas, Mindanao.
It comes po sa term na GP and moonlighter po. Ano po ang pinagkaiba nila?
Kumbaga, it's by definition it's someone who has not entered any specialty or hasn't undergone any specialty training. Moonlighting naman is actually slang term, or it's not really the formal, but it's just a term that stuck to us here in the doctors in the medical practice. Basically, it's someone. It can be a GP, it can be an IM, an OB who will work or who looks for positions in hospitals. So meaning parang they call going on duty in a hospital or in a clinic, they call it moonlighting. But the actual term for that is being a hospitalist. Yun yung talagang term na comparable siya, like if you look in the US setting, no? We call it being a hospitalist, going on duty. Yung sa pag-introduce mo sa akin, yung nakalagay dyan, a house physician, yun, that's the title of a moonlighter when they are on duty, or resident on duty, or physician on duty. They're moonlighting for a day. It's not like in residency na you are there for how many years. No, that's essentially what moonlighting is. But it's not limited to general practitioners.
How about po when it comes to skill? Kasi po, di ba, given naman po, is there a specific skills that you need to acquire?
Being skillful, no, the word itself is quite subject to debate. So yeah, since mga med students, I mean mga soon to be physicians naman ang audience natin. So I would like to remind you in medical jurisprudence, no, what is expected of a doctor is not really defined by skill, but it's the clause there is something that is expected from an average. No, the term actually there is an average physician, no, but who is acting in their good faith, but hindi sinespecify doon like how skillful. So it's just what is expected from the average. Just parang yun din, ang hirap sabihin ng average. I think the best yardstick for this would be the skills that are taught to us, or at least introduced to us in the course of clerkship, no, and postgraduate internship. As a general practitioner, it's actually also up to us, or as a doctor, it's really up to us to choose what skills we need, or what patients we would see, because we can always refer naman patients if we feel we are not really confident, for example, in performing a certain surgical procedure, even if it's just a minor surgical procedure. Then if it's a bonus for you, no, if you want to be able to handle more patients. For example, even as a GP, you want to work alongside a midwife in a lying-in. It's also a plus for you if you are confident in delivering non-high risk pregnancies. So I think, the best answer to that question is we should be able to perform mga minor procedures that in the clinic, in the office, like ear cleaning, for example, or document sexually transmitted infection. So I can give so many examples, but the general picture here is this is something, a service we can give a patient right away. Yung hindi not necessarily kailangan i-admit, or not necessarily kailangan specific appointment, which is more expected in a secondary hospital or a tertiary hospital.
Okay po, Doc. So speaking of clerk po, Doc, since na-mention, for the clerks who were trained in pandemic po, Doc, since po, we're still in pandemic, even though recovering na po tayo, what can you say about going into GP first before residency po?
Specialize in a particular field, and they are already set, no? Parang kunwari, they really want to go into surgery. For me, I think it is best that they already go to their path, no? They go straight as if ever they will be accepted, kasi baka iba rin ngayon yung iba rin ngayon yung preferences ng training hospitals. That I cannot really say, no, it really depends. But if you are the doctor who is really willing to experience the world, or you are not yet that sure on what you want to specialize, then definitely going into moonlighting or working as a GP or explore other fields, no, like doctors to the barrios. Marami din akong kilalang colleagues na gano'n, no? Or they work in public health. They become the municipal health officer, or they work in the health center, in the municipal or rural health unit, because that way, no, talagang you will be exposed to anything under the sun. And it's also that's a really good way to find out what you really want to do, no, for the rest of your life. So yeah, that's my take on that.
Okay po, Doc. So, next po, Doc, is when it comes to procedure po, Doc. Like, what are the procedure po na nagagawa ninyo?
Personally, in my kumbaga on my own, no, when I mean personally, independently, I do wound debridement and I excise small masses, no, that's what I meant, no, it's specifically in minor surgeries. I didn't have any circumcision cases, procedures this pandemic, yeah, but before I did. So most of the house calls I do involve some form of excision or wound debridement. So like mga benign lang, no, lipoma, fibroadenoma, things like that. Kumbaga, when I'm in a facility naman, like the hemodialysis unit, so I assist in the maintenance of the IJV catheter, no? The jugular vein catheter. So may mga procedures naman doon wherein I'm assisted by nurses.
When it comes po, Doc, sa organization po, like, ano po ba yung mga organization ang nag-accommodate po sa mga GPs po?
There are specific societies by parang by region, but they really specifically like pang GPs lang. I understand. I think the comparison here is being made with yung kunwari PCP, no, Philippine College of Physicians for internists. But there's also I believe, but I'm not a member, but I've heard about it. There's a society for general practitioners. Pero I think kasi parang may mga chapters. So personally, I'm not really familiar on how they function. So ang talagang sure lang ako yung kunwari Southern Luzon na medical association or a medical association among doctors from Cavite, but hindi naman siya for GPs lang, parang everyone can join.
Okay po, Doc. Curious lang din po, Doc. Aside from like you do research po and you're very active po sa research. But other than that po, ano po ang ginagawa niyo or ways po ninyo para maging stay up to date po kayo sa mga events or like mga, especially po sa medical field po, always po kasi nag-revolve, may mga bagong drugs, bagong practices, bagong procedures po. Paano po kayo nakaka-catch up po sa ganun?
This pandemic, it's been harder to maintain ties with specific mga colleagues, but I use the social media mostly. I follow different training hospitals, no? Like for example, PGH, UST, St. Luke's. So if they have continuing education activities or continuing medical education, yung CME, mga webinars or virtual conferences. Kasi in virtually this pandemic, lahat virtual. So that's how I stayed up to date. So talaga I just follow a lot, and on my own I just keep reading and reading. No? I really believe that our profession involves lifelong learning. So I actively from time to time I actively look for updates, guidelines in common diseases like OPD. So I explore if there are new guidelines even from and that's also how I see if there are newer drugs. I also follow medical journals like NEJM, New England Journal of Medicine. They would from time to time they would publish all these updates. So I will read through them and see. Sometimes I would search, is this available already here in the Philippines? And then there's another one. Since you mentioned about drugs, this personally, what I do. I would go to the drugstores like Mercury Drug and actually ask them what is in stock. Kasi they teach us a lot of drugs in pharma, but not everything is available or even affordable. So I actually do that so I can advise my patients better on what they can mga alternatives, no, to their prescription, whatever is prescribed to them.
Yeah, kasi as a pharmacist po, Doc, talagang when it comes to drugs po, ang daming bago.
Yeah.
And need po talaga mag-update time to time po.
Yes.
Kasi, like for example po yung sa cephalosporins po, like fifth generation
Fifth gen
na.
Yeah.
Yes po. So, need po talaga siya.
Meron din sa memes wala rin memes Philippines, but yun nga, when I ask around here in local drugstores, wala pa naman pala. So yeah, parang there's of course we expect that there's a gap, and di ba when there's a new drug, usually it's very expensive pa. So ayun, I think it's good that you're a pharmacist. It's really one of the drugs, it goes parang it's beyond what we learn in medicine, but knowing how yung mga aspects na gano'n, yung supply and demand, it also affects our patients kasi it limits the availability, the price.
Yes po. Yung resources po. And funds. Okay po, Doc. So since po, di ba, doctor po kayo, what do you like the most for being a doctor po?
Okay. Like the most, isa lang pwedeng answer. All right. Sige. I think the overarching thing that I like best, no, in being a doctor is that the profession allows us to make positive difference in the lives of people. Of course, other professions do that. Many professions do that. It's service-oriented profession. But kumbaga, that's what seeing the positive change or seeing how as a doctor we are able to change lives, no, for the better, not just of the patient, no, seeing the relief in the patient and also the family, and even among our patients, who die, mortality sila, but being there with the family and being able to touch, no, their lives, and being with them as they fight with their loved one, that for me is a very fulfilling experience. It's not always happy, but it's always fulfilling. So that's pretty much it. But yun nga, para top 3 or top 2, I also enjoy much teaching students, no, teaching medical students, and that's why I am engaged in the academe, because I think that yun nga, if I alone would not be able to make such a big difference in the world. We're just a speck here and our life is short. So parang I think I can make the most out of the goodness that I want to share by also helping others realize their dreams, and by also inspiring them, motivating them to do their best so that they too will also experience that very fulfilling experience of being a doctor.
So as you said kanina, Doc, na being a doctor, hindi siya madali and meron talagang hardships po. Yung aspects po of practicing general physician. Ano po yung nakikita mo or like you find it most challenging po?
I think the main limitation that I see is how general physicians can manage patients who are complicated, meaning who have complicated diseases or who have many comorbid conditions, because there are so many patients like that. And itong patients na to to go to so many doctors also, like they go to a general practitioner, or sometimes they go to to the health center simply because they don't have the resources, no, to access the healthcare from different specialists. So that I think is very challenging kasi andun na yung limitation ng resources, and they cannot travel far, let's say to PGH, and there are also limitations sa availability, mahaba yung pila. So as a general practitioner, I'm torn with that question na andito na sa harap ko yung pasyente with all these problems, na I think I can help with some of the problems, maybe thankfully if all of the problems. And of course, that is going to be that would really be tiring, and that would really consume much of my time. When I think about it, as a general practitioner, parang nagiging all-around ka kasi. Like, ang hirap mong pauwiin yung patient knowing that there are still unanswered questions, that there are still unresolved problems. So, for me, hindi ko yun magawa. So I really do my best, no? For me, yun, that is when it becomes most fulfilling. No, when the patients tell you that even if they have all these troubles, parang somehow very nakakaginhawa yung experience. So it's really challenging because you don't know how much committed you will be to your patient, especially if malaman mo nga na they're the ones that can't really afford a lot. No, so I won't have the heart to charge them a lot also. But then, even if it's the most challenging, my point here is it also becomes the most rewarding. Kasi as a GP, parang andun ka you are at that position to be able to help with them with different or various problems, not just one specific complaint that they come to you. Let's say if you're a specialist, na you would have to refer them to another. At least as a GP, you get to give advice and everything, and then yun na nga lang, hopefully they can seek further workup or care, for their complicated conditions.
Pumunta naman po tayo, Doc, sa specialty po. In medical field po, hindi naman po maiwasan na we should work, hand in hand po, like with other professions or with other specialties po. How do you collaborate with them po?
In my work as in the research, so we do clinical trials, so with the different health officers from the different provinces of Cavite where we do it. So we have protocols for doing that. So everything is formal man. So we still need to endorse patients properly. And if there are some findings that we come across that are not yet documented, so aside from documenting it on our own, we also have to give others heads up. So what's important there is, even if yun nga, iba-iba yung professions, colleagues from different specialties, we are part of a team, a multidisciplinary team or multi-specialty team. You have to always communicate with them. Ngayon, usang-uso na ngayon yung Viber chats, Telegram. So we actually use that kahit ganoon. We update them through these platforms. Ganun din in the clinical setting. In my work as a hemodialysis physician, I have to collaborate with their attending nephrologists. I'm the one on the ground kasi. So when they do their dialysis, the complications that they experience while they are undergoing treatment, I am the one who has to respond to that. I'm the one who has to manage that. So when such happens, I also have to update their attending nephrologists, especially if medyo toxic or there's complication nga. If hindi naman ganun ka toxic, I would just have to update them, especially if there are new complaints or new developments, laboratory results. So very important yung constant communication with the attending physician. Sometimes it's not just the nephrologist. As a general physician, you are the one who coordinates between different doctors or different specialists. Kasi sometimes these specialists are not really, they don't know each other. So alam mo nangyayari na the point of view of one specialist, for example, the cardio versus the point of view of the nephro, parang minsan magkaiba or there are nagka-clash sila, or the endo, especially pag may diabetes. So it's also up to you to be the one to coordinate, facilitate communication with the rest of the team, and ultimately be the one to parang integrate and summarize this for the patient. Kasi the patient, parang sila mismo nako-confuse or naguguluhan because of this sometimes conflicting advice. So they binabato rin nila sa atin ano ba ang best gawin. So very important talaga in our profession is open communication. And the same is true when I had moonlighting stints before I had the regular work. I also did a lot of moonlighting, 24-hour duties, even 48-hour duties. So it's really communicating with their attending physician. So when a patient is admitted in the ER, let their attending physician know what happened. You will endorse the case. So kailangan masanay talaga tayo in presenting concisely kasi mabilisan lang. And then when the attending physicians go on rounds, the specialists or the other specialties, you will also be the one to update them. They would really appreciate it if there's a doctor who would brief them about their patient. As if you are, what the resident in training does, a GP also does. The difference lang is they're not in training. So ganun din, you communicate with other professionals, nurses, very important yan in what we do.
Especially po, Doc, ang dami niyo pong field of work po. So,
yeah.
As you mentioned po kanina, Doc, na nag-work po kayo sa hemodialysis center po. How was it po? Like, how's the experience po?
Of course, it was daunting. I'm unfamiliar with a lot of the mechanics or the technical aspects of how dialysis or specifically hemodialysis works. But again, pag may mga ganitong challenges, just like what I said kanina, I face them because hindi pa ako parang hindi pa ako na-disappoint na fulfilling at very rewarding talaga once you get the hang of it. So after some time, I got used to the environment naman, and I have been seeing a lot of these patients since they're on regular dialysis, maintenance dialysis. I get to see them every week or every few days if I go on duty several times a week. Eventually, parang kahit hindi ka yung attending nephrologist nila, parang mo na rin sila, pasyente mo na rin sila, like as in personal patient mo na rin sila, because kumbaga a bond forms already between you and these different patients because you're the doctor who they see more often. You're the doctor who they get to approach, or yung mga things that minsan nahihiya sila i-express sa attending nila because parang limited yung time. Sa atin nila masasabi. So that one also create that bond or that experience of being able to relate with the different patients. That's why I been there since for going 4 years already.
How do you approach discussing unpleasant topics po with your patient po?
I have to first get their point of view. Like I have to know where they're coming from. Let's say I would tell them that they have to do this procedure to find out if they are at a certain risk for a complication. And I already know that they are financially constrained, but that complication is potentially life-threatening. So pag mga ganitong topics, I think it's important to really relate and empathize. First, find out where the patient is coming from. Kumbaga, I ask them first what are their thoughts or ano yung in Tagalog, no, in Filipino ay ano yung bumabagabag sa inyo or ano po yung pinakakinakatakot ninyo. Before I go to the specifics of what I will discuss with them. So, I first find out ano po ba yung nararamdaman nyo nung nasabi ito ni doktora o nung attending niya. I try to first get their feelings so that I would also know the best way sana. Hopefully, it's the best way so that I can explain it na mas nakaka-relate sa kanya. So, some of us insensitive, no, or very paternalistic.
What if po to? Yung patient is, hindi naman po kasi lahat nakaka-receive or like nakaka-accept ng mga bad news in a calm way po, di ba? How about po yung mga pag may violent reaction po, sila like, how do you handle that? Or for example, if palit na yung pasyente.
Yeah, I also had a share, no, of such episodes or experiences, no. I think ganun pa rin eh. You have to feel or you have to ask them, kumbaga, or sometimes not directly ask, but you have to think, ano ba sa tingin natin ang kinakagalit nila? Like usually they're being impatient because parang kanina pa paulit-ulit na tinatanong or they've been waiting for so long for this and they do not understand bakit may delay or what the problem is. I think in most cases patients get angry because they do not fully understand the situation. And tayo rin naman, no, if we don't know what's really happening around us, we just know we're in a bad situation, we would feel bad and parang we're frustrated. So I would first consider that and do my best to figure out ano ba yung tingin kong hindi pa nila naiintindihan or na-appreciate, and I will try to start from there. But if very violent, let's say, or kaya parang some would even say offensive things, experiencing niya, no? As a doctor, dadaan din tayo dyan. Pag ganun, we give them space, and parang it's best also to let ourselves also make sure tayo ay kalmado rin. We definitely should not fight fire with fire. But at the end of the day, you're still a doctor and you still have to make the patient understand. Communication is very therapeutic. And them understanding their situation, their condition is very empowering because they really need to understand para they can decide what is best for them. That's the best way we can show respect to them. We let them decide, di ba? Principle of autonomy. But they cannot decide if they don't know what's going on and why ganito yung mga nangyayari. So, yan. I think, that's usually what I do.
I'm curious po, Doc, kasi each doctor po, iba't ibang philosophy when it comes to their practice po. And both you po, ano po yung philosophy niyo when it comes to treating your patient po?
Well, I don't have like a quote, like parang quote or motto, but yeah, treating a patient or being a healer takes place in different levels. So just in connection now with what I said, is already therapeutic. So for me, immediate results, yung improvement na kanilang pakiramdam is not always attainable in all ones. The process can be painful and it would take days to recovery. Sometimes it would take months, especially in the patients I handle for mental health, primary care for mental health. What I make sure na lang is at every encounter with patients, I am able to make them feel better or lighter. So even if I cannot give them the immediate cure or wala talagang cure, I want to be able to pagaangin yung kanilang nararamdaman and ease if they have any troubles or anxieties about their disease.
Nagka-pandemic pa tayo last 2020 po. And meron pa like almost 2 years na po, 3 years na po yung pandemic. And then, yung may mga na-shutdown po, nagka-lockdown po, online classes po. So, when it comes to that matter po, what challenges do you feel physicians are facing today po? And especially the graduating clerks who are trained through online almost half of their medical school years po, Doc.
For our students, yeah, since I'm able to see them in LaSalle, the biggest, I think, in clinical practice is them not being able to see as many patients as it had been before the pandemic. Iba kasi talaga yung face-to-face or actual patient encounter. I think though na even if that's a gap, it can really be filled naman with the alternatives. I just think na many of the doctors, soon to be doctors, parang they are doing their best to be able to fill that gap. Like they really go out of their way to see new patients. I mean ngayon na face to face na. But knowing that that's their situation, I think many of them somehow lose confidence. Parang kahit na ginagalingan nila, they're doing their best. They have that they have that constant thought that they may not be enough because of the pandemic. So parang aside from the kulang sa actual experience, parang this psychological factor can also be something na I think now we need to address. We need to constantly boost their confidence ako as their senior or as a doctor who was ahead of them. I try to keep encouraging them na it's not supposed to be a disadvantage. Kumbaga, that's another challenge, and just like yung lagi ko kanina sinasabi, we can make this work for the best. So para hindi naman sila panghinaan ng loob.
In medical school, hindi po lahat ng students is consistent. And hindi po lahat is, parang they have good grades or they always get good grades. Sometimes, yung performance nila is below average po, which is normal po, diba? Para po sa mga students po na nakaka-experience po ng ganon, pero able po sila to graduate po, what advice can you give them po? Is it too late po ba na mag-exert pa sila ng effort po para sa future nila as a physician?
I think that's all. Yeah, that's another factor na isa yan sa mga lagi kong sinasabi sa students that academic standing or grades will definitely not define us, our abilities, future abilities and prowess, as a doctor or a healer. So ako, I had good grades. I'm above average, I at the top of my class, and I topped the board exam. But I would honestly tell you very, very forthright, I learned more after the boards, and what I do or what I apply in clinical practice now is actually far from what was I learning, or was I really learning back in med school. Or so I can really say, yes, I did well in my studies, but doctor is not very, very far from taking exams. As I've been describing, it's a big part of our profession is being able to relate with our patients, it's being able to communicate with our patients and our colleagues. And these are not these are things that are not really there's something that we encounter when we're already in clerkship or beyond. So much of what I do right now are things that I learned after board exam. So definitely it's definitely never too late. I also mentioned earlier kanina, di ba, profession entails lifelong learning. So we have to stay updated. So it's really never too late. Maybe yung mga drugs na pag-aralan natin before there are newer na. So these students who feel that they're below average, yun nga, dapat hindi sila ma-discourage or sana mas ma-motivate pa sila because this is really their passion and this is really their dream. No one can stop them. And remember now, our patients ask about our grades or our standing. What's important for them at the end of the day is how we cared for them, how we dealt, how we approached them, how we related to them, and of course the comfort that they felt while they're undergoing treatment in our care.
That's very inspiring po, Doc. And very motivational. Board exam, Doc. Ano po mga study tips po ninyo para po sa mga students, yung sa mga aspiring po na maging board top-notcher po, Doc?
I think this is for everyone naman. I find that is really most effective even if it's something difficult to get used to at first is to keep on answering questions, practice questions or yung mga question banks. There's a lot of review books or meron kasi ngayon yung mga paid na question banks yung UWorld or AMBO. But there are also those that those you can access in different parang minsan may mga trial mode. And then there are PDFs of so many board review questions or even those na yung coming from our different schools. What's important is really active practice or active recall. Hindi ganun ka effective if it's always just reading and rereading handouts or transcriptions or even the books. Kailangan we are constantly simulating being asked questions para prepared, parang sanay-sanay na yung mind natin na pagdating ng board exam, it's just like what we've been doing for the past few months or so. So yun. One advice, magsagot ng practice questions.
Noted po yan, Doc. Last question, Doc. Why should one choose to be a general physician than to be a specialist, Doc?
Okay. Maybe for me, I can't really. And it's not about why you should choose being a GP. But maybe what I can impart is what can be more fulfilling about it. Because if you really have a dream in mind, like if you want to be an pediatrician or obstetrician, then go for it. That we are all entitled to our dreams. Ako, I also saw myself as a specialist before, neurologist or neuropsychiatrist. That is my field of interest. But as a GP, I also handle neuro and psych patients on a primary care level. Kasi kaya naman yung iba eh. Ayun nga, not those that are not complicated, those that do not require ICU admission, for example, or yung limbawa yung mga may threat threat to self, yung violence or harm in psych. But as a G, fulfillment pa rin na you can help, you can extend your help to a bigger population. You can be more flexible since you are always exposed to different cases, different patients, matanda, bata, or anything under the sun. And another thing, the fulfilling about it is you kumbaga you get to see the patients first. Many patients who encounters GPs have never been to a doctor before, or they have never seen a doctor before. So kumbaga fresh, parang you have the opportunity to really make a difference. And at the same time, and then if you're a GP, I think it keeps your mind open to more avenues, no, in becoming a 5-star physician. Of course, as a specialist, research, academe, andun naman lahat yon. But I think na for those who wouldn't go into specialty training agad, when they work as a GP for a year or two or more, they would be able to experience the profession in different aspects, and this could help them nga decide on what they want to specialize on or what they want to concentrate on in the future. So yung mga colleagues ko, for example, Dr. Sudabario, now they are in DOH, or those that work as research, now they're in drug development. So parang there's really more. Ang dami-daming doors. We are a general practitioner.
Goosebumps, Doc. I don't know, Doc. Baka mag-GP na lang din po ako if God's will. Unbelievable field. And yeah, I
think that's it, the flexibility. And yun nga, parang kasi here in the Philippines, parang to put it into perspective, no? Parang there's this also some kind of stigma na general practitioners or the primary healthcare providers, parang some patients I've encountered them, they prefer to be seen not by a GP, no? But in other countries, parang you cannot actually directly consult a specialist. Like you have to go through a GP. Yeah. So that's actually the model of more healthcare. So I think tayo din, if you do become a GP, or for everyone who would decide not to go into specialty training, yun nga, maximize nyo. There are so many possibilities beyond yung what moonlighting is. Yung kumbaga ano yung typical definition. Kasi moonlighting can be anything eh. Basta you're not in residency, it can be called moonlighting. So yun lang, we can talagang ang daming pwedeng gawin. Tayo lang yung kumbaga, it's only us who will be. So
yes. Alright, that's it, Doc. Thank you so much po sa time nyo and sa mga inspirational words po. Thank you po sa and thank you po sa pag-open po ng eyes namin about sa GP po. Kasi me personally, I barely hear anything about it po. And it's very, very interesting po.
Alright.
So, thank you po, Doc. Thank you so much po.
You're welcome. Thank you very much also to to Judy, my student, pag-graduate na siya, and to the APMC SN team for this opportunity to speak to the students.